Bismillahirrahmanirrahim. Hadith of the day, Ibn Abbas radiallahu anhu reported the Messenger of Allah sallallahu alaihi wasallam said, "There are two blessings which many people lose. They are health and free time for doing good." Assalamu alaikum everyone. Uh, my name is Dr. Marina Akhtar, PGR Community Medicine. Today, my topic of presentation is radiation. I am presenting this topic under the kind supervision of my professor, Dr. Saira Afzal. Learning outlines, introduction of radiation, types of radiation, source of radiation, protection from radiation, national safety policy, recent advances, and in the end, MCQs. Learning outcomes. At the end of this presentation, the participants will be able to describe about the radiations, its type, sources, hazards, as well as protection on the national level. Introduction of the topic. Radiation is energy that comes from a source and travels through space at the speed of light. This energy has an electric field and a magnetic field associated with it and has wave-like properties. It could also call radiation as electromagnetic waves. Radiation is the flow of atomic and subatomic particles and of waves such as those that characterize heat rays, light rays, X-rays. All matter is constantly bombarded with radiation of both types from cosmic and terrestrial sources. Radiation may be thought of as energy in motion either at the speed equal to the speed of light in free space approximately 3 into 10 to the raised power 10 centimeters 1,86,000 miles per second, or at the speed less than that of light but appreciably greater than thermal velocity, for example velocities of molecules forming a sample of air. Types of radiation. There are two broad classes of radiations are differentiated by their speed of propagation and corresponding presence or absence of rest mass. The first category are referred as electromagnetic rays plus neutrino, and those seconds are of matter rays. Electromagnetic radiations. The first type constitute the spectrum of electromagnetic radiation that include radio waves, microwaves, infrared rays, visible light, ultraviolet rays, X-rays, gamma rays, as well as neutrino. And with different wavelengths, these are they have different uses. For example, radio waves used to broadcast radio and televisions, and microwaves used in the cooking, radar, telephone, and other signals, and infrared transmit heat from the sun's fires and radiators. Visible lights makes things able to be seen, and ultraviolet absorbed by the skin used in the fluorescent tubes, and X-rays used to view inside the body and the objects. Gamma rays used in medicine for killing cancer cells. The electromagnetic spectrum. There are wide range of electromagnetic radiation in nature. Visible light is one example. Radiation with highest energy includes ultraviolet radiation, X-rays, and gamma rays. Gamma rays and X-rays have short wavelength. They are deep penetrating radiation. X-rays and gamma rays have so much energy that once when they interact with atom, they can remove electrons from them and cause the atom to become ionized. These all characterized by two mass when theoretically at rest. Matter or corpuscular radiations. This type includes such particles as electrons, protons, and neutrons. In a state of rest, these particles have mass and are constituents of atoms and atomic nuclei. When such forms of particulate matter travel at high velocities, they are regarded as radiation. For example, alpha particles, beta particles, electrons, and protons. Alpha particles are 10 times as harmful as X-rays, beta particles, or gamma rays. Alpha particles luckily have little penetrating forces. On other hand, they are quite dangerous if radioactive substances has entered the body by inhalation or through a wound. This picture showing the penetrability of alpha, beta, neutron, and gamma rays. Alpha rays cannot penetrate through even through the paper. Beta rays can penetrate through the paper and the human body. And neutron have more permeability than the alpha and beta rays, and gamma rays are the one of the most penetrable rays that can penetrate even through paper, metal, water, concrete, and lead. And this picture again showing that alpha rays cannot penetrate even through the paper, and beta rays can penetrate through the paper, and the gamma rays can penetrate through the paper, aluminium, and also from lead. Source of radiation. There are two main sources of radiations. These are natural source or man-made source. This picture showing the different sources of the radiations. Radon gas, that could be food and in medical test, and cosmic rays and nuclear test. Natural source of radiation. Man is exposed to natural radiation from time immemorial. Natural background radiation arises from three sources: cosmic rays, environmental rays, and internal radiations. Cosmic rays. The cosmic rays which originate in outer space are weakened as they pass through the atmosphere. At ordinary living altitude, their impact is about 35 millirad a year. At altitude above 20 kilometers, cosmic radiations become important. It has been calculated that commercial jet pilot receives about 300 millirad or 0.2 to 5 millisievert per year from cosmic radiation. Environmental. Terrestrial radiation. Radioactive elements such as thorium, uranium, radium, and an isotope of potassium K40 are present in man's environment, for example, soil, rock, buildings. It is estimated that man derives about 50 millirad per year from terrestrial radiation. Area exists, for example, Kerala in India, where there are rock formation containing uranium. It can be high as 2000 millirad a year. Atmospheric radiation. The external radiation dose from the radioactive gases radon and thorium is in the atmosphere is rather small, about 2 millirad per year. Internal radiation. Man is also subjected to internal radiation from radioactive matter stored in the body tissue. These radioactive materials include minute quantities of uranium, thorium, and related substances, and isotopes of potassium K40 and strontium SR90 and carbon C14. It is estimated that total natural radiation to which average person is subjected comes to approximately 0.1 rad a year. Man-made sources are three man-made sources are X-rays, radioactive fallout, and third is miscellaneous. X-rays. The greater man-made source of radiation exposure to the general population at the present time is medical and dental X-rays. Two distinct groups are involved. First is patient and second is radiologist and medical technicians. When optimum radiographic techniques are employed, the skin dose to the patient from a single X-ray film varies roughly from 0.02 to 3 rad. Radioactive fallout. Nuclear explosion release a tremendous amount of energy in the form of heat, light, ionizing radiation, and many radioactive substances. The important being the isotopes of carbon C14, iodine I-131, cesium CS-137, and environment and health strontium SR90. CS-137 and SR90 are considered most important because they are liberated in large amount and remain radioactive for many years. Miscellaneous. Some everyday appliances, for example, TV sets, luminous wristwatches are radioactive, but radiation from these sources are present in too small to be important. And these appliances showing the non-ionizing where the non-ionizing radiations and ionizing radiation in the X-rays. Radiation units. The activity of radioactive material is in the number of the nuclear disintegration per unit of time. The unit of activity is becquerel 1 becquerel is equal to 1 disintegration per second. The potency of radiation is measured in 3 ways. Roentgen, uh, ro- Roentgen, Roentgen is the unit of exposure. It is important. It is the amount of radiation absorbed in the air at the given point, the number of ions produced in 1 ml of air. And second is rad. Rad is the unit of absorbed dose. It is 1 millirad equals 0.01 rad. And third is RAM. RAM is the product of absorbed dose and modifying factors. The RAM indicate the degree of potential danger to the health. The other radiation units, the radiation units Roentgen, RAD, RAM are being replaced by new SI units, International System of Units, which are coulomb per kilogram, replacing the Roentgen. 1 Roentgen is equal to 2.58 into 10 to raise power 4 coulomb per kg. It is the unit for exposure. There are no special name for this. And B is gray. Gray replacing the red. The unit of absorbed dose defines the dose of ionizing radiation that impart 1 joule of energy to 1 kg of absorbing material. 1 red is equal to 0.1 gray and sievert replacing the rem. It is the SI unit of dose equivalent. These dose equivalent of 1 sievert is equal to 100 rems. And this picture showing that SI units and also common units, that is SI units is big becquerel, and common units that were used are curie. Absorbed doses are gray and that is replacing the rad, and dose equivalent is sievert that is now replacing the rem, and exposure is coulomb per kilogram and that is replacing Roentgen. Biological effects of radiation. The effect of ionizing radiation can be somatic or genetic. Somatic further divided into the immediate or delayed effect. Immediate are first is radiation sickness and second is acute radiation syndrome. High dose tend to kill cells causing organ damage. This in turn may cause whole human body response after called acute radiation syndrome. And delayed effects are leukemia, carcinogenesis, fetal development abnormalities, shortness of life, and genetics may be chromosomal mutations and point mutations. And this picture showing the different effects of drugs and radiation in the different intervals of pregnancy. At pre-implantation period, 0 to 2 weeks after conception, different use of dangerous drugs or radiations may cause miscarriage of the fetus. And organogenesis in the organogenesis period 2 to 8 weeks after conception, this may cause dysplasia or malformation of the fetus. And the early fetal period 8 to 15 weeks after conception may cause the mental retardation. And the threshold dose of radiation is 0.1 gray or more. Biological hazards. Less than 5 rad, there is no immediate absorbable effects. 5 rad to 50 rad slight blood changes may be detected by medical evaluation. 50 rad to 150 rad slight blood changes will be noted and symptom of nausea, fatigue, vomiting, etc. 150 rad to 150 rad to uh, 150 rad to 1 sorry, it is 150 rad to, I think it's 1000 rad. Severe blood changes will be noted and symptoms appear immediately. Approximately 2 weeks later, some of these exposed may die. And 300 to 500 rad, up to one half of the people exposed will die in 60 days. And 1100 to 2000 rad, the probability of the death increase 100% within 1 to 2 weeks. And greater than 2000 rad, that is a certainty. At doses above 5000 rad, the central nervous system, brain and muscles can no longer control the body function including breathing and blood circulation. Medical care is for comfort only. Radiation protection. Unnecessary X-ray examination should be avoided, especially in case of children and pregnant women. It also implies adequate control and surveillance of X-ray installation, protection of the workers, improvement in the techniques, and the improvement leading to dose reduction. Effective protective measures include proper use of the lead shield and lead rubber apron. Lead apron 0.5 millimeter of lead will reduce the intensity of scattered X-ray over 90% and should be worn by all workers regularly on daily basis associated with X-ray procedure. And second is worker must wear a film badge or which show accumulated exposure to radiation since last time in the instrument was charged. Beside the periodic medical examination, regular working hours, recreation holidays must be ensured to the workers to maintain their state of a healthy life. The International Commission on the Radiological Protection ICRP ICRP's recommendation on radiation dose level for occupational workers and for the general population have been adopted for many countries. It has been recommended that radiation doses to the whole population from all sources additional to the natural background radiation should not exceed 5 rems over the period of 30 years. WHO has published permissible radiation levels in the drinking water. The International Atomic Energy Agency has sponsored many symposia on radioactive waste disposal and associated subjects. Its main concern has been to promote peaceful use of atomic energy and ensure that these use do not imperil peace or health. National Safety Policy. The government of Islamic Republic of Pakistan is considering the protection of present and the future generation of Pakistan and environment as its national responsibility, has established Pakistan Nuclear Regulatory Authority, PNRA, that makes that policy short title, extent, applicability, and commencement. This policy may be called as National Safety Policy, NP2 2020. This policy extends to the whole of Pakistan. Pakistan is committed to ensure nuclear safety and radiation protection through effective and sustainable regulatory mechanisms, striving for the continuous improvement and giving overriding priority to safety. Accordingly, necessary safety infrastructure has been established and is continuously being strengthened by providing necessary financial and human resources. Implementing principles include the government shall ensure the implementation of this policy through PNRA. All the relevant stakeholders must adhere to the following principle and subsequent strategies to achieve the commitment of the government. First is the prime responsibility for safety must rest with the person or organization responsible for facilities and activities that give rise to radiation risk. This shall be achieved through the provision of adequate human and financial resources. And second is effective leadership and management for safety must be established and sustained to organize in organization concerned with and facilities and activities that give rise to the radiation risks. Facilities and third is facilities and activities that give rise to the radiation risk must be yield an overall benefit. This shall be achieved by taking into account all significant consequences of operation of facilities and conduct the activities ensuring that benefits overweigh their associated risk. Fourth is protection must be optimized to provide the highest level of safety that can be reasonably be achieved. This shall be accomplished through the assessment of radiation risk throughout the lifetime of facilities and activities, applying graded approach and using good practice to avoid the radiation risk as far as practicable. And fifth is measure for controlling radiation risk must ensure that no individual bear an unacceptable risk of harm. This shall be achieved by maintaining and controlling the radiation dose within the limit specified by PNRA. People and the environment present and the future must be protected against radiation risk. This shall be achieved by taking into account the possible consequences arising from the facilities and activities by providing adequate protective measures against the radiation exposure. The radioactive waste generated from such facilities and activities shall be managed so as to avoid imposing undue burden on future generation as well as minimizing waste generation. Seventh is all practical efforts must be made to prevent and mitigate the nuclear or radiation accident. This shall be achieved by implementing the principles of defense in depth in the design, operation, and effective management system. Eighth is arrangement must be made for the emergency preparedness and response for the nuclear or radiation accidents. And ninth is protective actions to reduce the existing or unregulated radiation risk must be justified and optimized. This shall be achieved by establishing appropriate protective measures to minimize the radiation exposure and to remediate adverse conditions. If the radiation risks are high, all persons and organizations involved in the management of facilities and activities using ionizing radiation shall devise appropriate strategies for ensuring compliance and with implementing the safety policy. What is ALARA? ALARA is as low as reasonably achievable. That is divided into time, distance, and shielding to reduce radiation dose. Remember the three principles of radiation protection. First is time. Less time spent near source, less radiation is received. Second is distance. Greater distance from the source, less radiation received. And third is shielding. Behind the shield from the source, less radiation received. Now coming to the recent updates. First article is lost opportunities for cancer prevention, historical evidence on the early warning with the emphasis on the radio frequency radiation. And in this article, they are discussing the cancer causing effect from radio frequency radiations. And in the three case control studies, they are showing that the number of brain tumors of not defined type were found in to increase in Sweden, especially in the age group of 20 to 39 years in both gender based on Swedish inpatient register. This may be caused by high prevalence of wireless phone use among the children and adolescents, taking a reasonably latency period and higher vulnerability to radio frequency radiation among the young persons. Second article is cancer risk following low dose of ionizing radiation, current epidemiological evidence and implementations for radiological protection. This is a pooled analysis and meta-analysis also involving the epidemiological studies. Highlights of these articles are that recent epidemiological evidence on radiation-related cancer risk is summarized. Substantial evidence exists that dose above 100 milligray causes cancer. Growing evidence that doses below 100 milligray may cause cancer was also found. Recurrent medical imaging procedure can result in the dose around 100 milligray. Hence, the radiological protection aspect should be considered in medical imaging. Third article is control of foodborne biological hazard by ionizing radiations. And explanation of this article is that the ionizing treatment of food has been approved in more than 60 countries. The international and national bodies define a maximum dose limit for each approved food product. Regarding the difference in the use of the gamma radiation and E-beam technology, the gamma radiation have very high penetrability compared to E-beam. The cost of electron accelerators is very high and decreasing as the technology is being more common. Meanwhile, the E-beam could be preferred because of having on and off production and it allows their in situ installation. On the other hand, for gamma rays, it involves handling of radioactive material. Therefore, the products are expected to be taken on the treatment facilities. The microbiological toxins and viruses are considerably resistant to the ionization radiation. However, the combination of the heat and ionization radiation can help to achieve food safety goal. Therefore, further research is needed to develop the guidelines and recommendations regarding combination treatment against biological hazards in the food. Now coming to our MCQ section. First MCQ is, During a fluoroscopy procedure, a patient complains of the pain and discomfort in the exposed area. What is likely the cause? Option A, allergic reaction to the contrast dye. Option B is radiation induced tissue damage. Option C is improper positioning of the patient. Option D is equipment malfunction. Option E is anxiety related symptoms.
E.
Answer is B, radiation induced tissue damage. A technician is handling radioactive material in the laboratory. What precaution is essential to prevent the radiation exposure? For example, first is wearing latex gloves. B is proper ventilation in the lab. C is using a Geiger counter for detection. D is standing close to the radiation source. E is regularly cleaning lab equipment.
A.
C is the right answer. A nuclear power plant experiences a minor leak, releasing low level of the radiation into the surrounding area. What should be nearby resident to be advised to do? A, remain indoor and seal window and doors. B, ignoring the situation as radiation levels are low. C, evacuate the area immediately. D is consume potassium iodide tablet as preventive measure. E is continue with outdoor activities but wear masks.
D.
Answer is A, remain indoor and seal windows and doors. A radiology technician is prepared to perform CT scan on the patient. What precautions should the technician take to minimize the radiation exposure? First is stand close to the patient during the scan. B is use the highest possible radiation dose for clearer image. D, C is limit the number of scans to reduce cumulative radiation
D.
exposure. Fourth option is D. Wear a lead apron and thyroid shield during the procedure. And fifth MCQ is a pregnant woman is accidentally exposed to the radiation during her first trimester. What is the primary concern regarding the fetal health? Option is increased risk of childhood leukemia. B is developmental abnormalities. C is low birth weight. D is delayed cognitive development. E is maternal thyroid dysfunction.
D.
Answer is B. The pregnant woman undergoes a dental x-ray. What precautions should be taken to minimize fetal exposure? A is use a lead apron to shield the abdomen. B is increase the x-ray exposure time for the better imaging. C is perform the x-ray without any additional precaution. D is avoid informing the technician about the pregnancy. E is postpone the x-ray until delivery.
A.
Yes, A is the right answer. The fruit exporter wants to reduce microbial contamination in their product without affecting quality. Which radiation-based method is most stable for achieving this? Option A, UV radiation. B, chemical radiation. C, pasteurization. D, fumigation with pesticides. E is electron beam irradiation.
A.
Yes, E is the right answer. 8th MCQs is medical facilities exploring radiation therapy option for cancer treatment. What is a significant advantage of using radiation therapy in the cancer treatment? Option A, minimize impact on the surrounding healthy tissue. B is increased risk of metastasis. C is limited applicability to certain types of cancer. D is shortage treatment during
C.
option A. Right, option A. A patient with severe blood allergy requires treatment. Which radiation-based methods can effectively eliminate allergens in the food products? Option A, irradiation of the food. B, microwave cooking. C, freezing at ultra low temperature. D is high pressure processing. E is chemical sterilization.
D.
Option A. The guidance documented ANSI tells of setting adjusting the distance boundary away from the x-ray source so that member of the public or non-badged badged person should get uh, more than uh, more than 1 milligram in an hour and 50 milligram in a year, 2 milligram in an hour or 100 milligram in a year, 3 milligram in an hour or 150 milligram in year, and 4 milligram in an hour and 200 milligram in year, and 6 milligram in an hour and 500 milligram in year. They are discussing about the protective X-ray exposure. The right answer is B, 2 milligram in an hour and 100 milligram in a year. And this is the key of MCQs. And these are references of my presentation. And this is YouTube link where all presentations are uploaded. And thank you so much for your patient listening.